welcome to Curated Conversations, a podcast by the Grand Rapids African American Health Institute, where we talk all things health and wellness. My name is Ashley Starr, and I will be your host for today's conversation. Today, we have Amber Bellazaire joining us today. Thank you so much for being here.
Thank you so much for the invitation.
You are welcome. I'm so excited to get into this podcast with you today and talk policy. So we'll start off with her bio. Amber Bellazaire is a senior policy analyst at the Michigan League for Public Policy. Her work focuses on state policy and budget decisions that affect Michigan's Medicaid programs. Before joining the league, Amber worked in the health program at the National Conference of State Legislators in Denver, Colorado, where she provided technical assistance to state legislators and staff and monitored state legislation related to injury and violence prevention and maternal and child health. Amber holds a master's in public health degree from the University of Michigan. So thank you so much. So we're just going to dive right into it. First question, what is healthcare legislation and why does it matter? I think that with today, with the political environment and so much going on, it seems like things are changing every single day. Why does healthcare legislation matter?
That is a very important question, and you're exactly right. It is so timely to be talking about this. And yeah, thanks again for the invitation to be here to talk about why legislation matters and how it impacts healthcare. So I'll start with just public policy generally. When we think about that, that's really any action that comes from local, state, or federal government. And action can mean legislation, laws, executive orders. We've heard a lot about that lately. Regulation, rules, and all of that action is to help influence and hopefully help improve outcomes for constituents and communities. So when it relates to healthcare, legislation impacts the doctors that you maybe have access to, the different types of providers, whether you can see a dental therapist or just a dentist. It impacts costs that you might see, access to certain services or medications, treatments that are available to you. So it can seem like they're really disconnected, but certainly public policy has a really big impact on healthcare and healthcare access.
Yeah, and so how does it shape the patient and provider experience from your understanding?
So from the provider perspective, right, if I'm a doctor and I want to work in Michigan, I have to get licensed. And so there are certain guidelines that the state would be setting. You have to do X, Y, and Z. You have to have this much education. And then in my practice, I might need to be also reporting what I'm doing, how I'm billing clients and things like that. So it certainly impacts the provider side. But I focus a lot more on kind of the consumer, individual, or the patient side of things. And that's going to look like, what kind of access to insurance do I have? What options are available to me? How much does this cost me? How much does this cost to have my kids covered or for this surgery and things like that? So I think when we think about healthcare, we're thinking a lot about doctor's visits and all of that. And certainly public policy has an impact there. But thinking even kind of upstream a bit, the sort of prevention and different kinds of interventions that help influence health outcomes. So I'm thinking about ways in which we might be funding local public health or WIC services, things that provide access to healthy foods, things that influence the kind of environment that we grow up in, parks, and all the rest. So there's lots and lots of different ways that we can think about health outcomes and the ways in which policy and funding, I think that's another big piece when we think about whether state or federal, the amount of funding that's being invested in certain programs or interventions.
And do you find when you speak of funding and policy, do you find that it varies drastically from state to state? And some seem like they're more fortunate, some less fortunate.
Absolutely. So, when you're thinking about federal legislation, that's kind of the floor, right? Federal laws are going to kind of set general guidance and parameters, and states then have a lot of option and flexibility for how they meet the needs of the folks in their state, the issues that they see arising. So it's going to be a lot more tailored to what a specific state needs. I think a lot of folks are familiar with the Affordable Care Act, and what came with it was Medicaid expansion. That's a really easy one to look at. So Michigan is a Medicaid expansion state, has been for a decade, and there are still states that have not done that. So that's going to look really different if you're an individual adult and you live in Texas versus you're an individual adult and you are, working class and you live in Michigan in terms of the kind of health insurance options that you might have available to you.
Sure. So how does state laws influence healthcare differently than federal laws?
I really think of them as just sort of layering on top of each other more than necessarily being highly distinct. But again, I think that funding piece is so important to identify. Part of what the Michigan League for Public Policy does is we are a policy and budget shop, so we focus a lot on budgets. And as I was driving here, I was listening to this song by J. Cole called Brackets. And anyway, he has this line where he just talks about where does the money go?
Right.
And so I think that's just a really kind of simple way. Right, exactly. It's we pay taxes. There's revenue that the government, state governments, local governments raise. Where does it go? And so we tried to use our work to kind of identify where is the money going? What are we investing in? And some folks really use the language of our budgets are our moral documents. They really show that we want to invest in housing because we recognize that's the need in our state. We know that we need to fix roads or we need to address health disparities, things like that. And it shows our priorities in that way. So there are some distinctions. Again, I really think of federal legislation as being these kind of broad guidelines, really setting a floor. You have to provide at least these kind of essential services under the Affordable Care Act. And then states have a lot of options to kind of add additionally how they want to implement certain programs or what kind of policies they want to adopt in addition to maybe what the federal government is saying is kind of that floor.
Yeah. So you spoke on, briefly mentioned health disparities. And of course, here at High, that's what we're all about, trying to help fight those health disparities. So how has current legislation addressed health disparities and social determinants of health?
It's a really important question. And I think that, there are many, many factors that influence our health. And so it can be really hard, just implementing one program 1 year isn't necessarily going to turn the curve. But we've seen a lot of investment in the maternal health space, I would say, at the state level. So thinking about state legislation, trying to advance group-based prenatal care that's led by midwives that's shown to have a really positive outcomes for individuals and their families and young babies. So we've seen investments there. We've seen the extension of postpartum coverage. It used to end at about 6 weeks after giving birth, and now in Michigan, if you're enrolled in Medicaid, you have 12 months. So you have access to mental health support and medications, doctor's visits beyond that 6 weeks if you have needs or questions about how you're feeling so that you can access care. And that's really to try and address some of the persistent disparities we see in the maternal health space. So there are really a number of different things. When we think about social determinants, pulling back out of just healthcare, there are ways in which Michigan is investing in pre-K access for 4-year-olds in our state, lowering the cost to free or very low cost for community college. And we know education is certainly a significant factor when we think about overall health over the longevity of the life course. So there's lots of ways, I mentioned housing, that we're kind of tackling what we see as kind of disparate outcomes when it comes to health in our state.
Okay, Amber, so let's talk access to care. So what are some of the main barriers that Michigan residents face when it comes to accessing health care?
Yeah, that's a really important question. I think especially because you hear that word thrown around so often, access. We want to improve access, increase access. And I think really what it means is, as simple as it sounds, is just getting in the door to see a provider, a doctor, a nurse. And there can be a number of barriers. So you think about just transportation, getting to and from. Folks maybe struggle with bus fare, gas, having access to a car to get them to their appointments on time. And when they're not able to get to appointments consistently, their care is interrupted. We think about childcare, right? It's okay, maybe I have a car, but there's no one to watch my kid, and I can't bring my kid to this 2-hour assessment, appointment, treatment, whatever it happens to be. I think cost is another huge one. Folks, I think, often are really concerned about what the cost might be and want to avoid going into medical debt. And so put it off. They don't go. And then what we see is often issues don't just go away on their own. Sometimes we hope, but they tend to get worse and ultimately are more expensive. So those are just a few things, but I think, feeling that the whole system is a bit intimidating, not knowing how to talk to a doctor, all of those things can be challenging. And I would say that the types of providers that are sort of these peer specialists, so you think of community health workers, doulas, peer support, substance use disorder specialists, folks who have kind of walked that walk before, are really great because they can help kind of liaise with someone who maybe is like, I've never really been in the medical field and feel really overwhelmed by what they might hear and how they have to make decisions and deal with billing and insurance and all the rest. And there's someone who can really walk them through that. And in some cases, it's really embedded in their care team. So their nurse is going to talk to their community health worker who talks to their doctor and the rest. And so it just kind of helps make it feel like you have a friend in the room, an advocate in that space for you.
Yeah, which I think is super important because a lot of times it is just not feeling like you have a friend or someone that genuinely cares about you in that space, which we know, goes into all these other things that we face as far as like, okay, well, maybe I just won't go to the doctor, and hopefully that'll go away because we just don't feel the space is safe. So I think it's super important to be able to provide those type of things to go ahead and get us into the doctor and get us into those spaces where our health can become a priority and we can really tackle that. So how do state healthcare policies in Michigan collaborate with local government efforts to improve healthcare?
Yeah, there's a lot of collaboration, I think, at different levels of government. The question makes me think first about a program that was really piloted first in Flint, Michigan, called RX Kids. And this is a program that's really focused on helping moms and babies by providing cash assistance, really kind of no questions asked. If you are an expectant person in Flint, then you receive a stipend during the prenatal period and then for a period of time when your new baby arrives. And this is something that was kind of done in partnership with state government, philanthropy in our state, and is now being expanded and piloted in a few other places. And so I think that's an example of the ways in which like a local idea can be scaled to hopefully impact other communities across our state. And this is such a great example of that public-private partnership doing a lot to improve outcomes for moms and babies in our state. Yeah.
So one of the things that we just recently launched here at GRI is our Black Womb Workers Doula Initiative. And we're super excited about that because recently Medicaid has decided to cover doula services. And we know that has been very much needed when we talk about advocacy, just having someone support you throughout that space. So we were so glad to hear that was one of the changes that were being made. So when you think about looking ahead, what key healthcare policies or changes do you see impacting Michigan in the near future?
So I would just start by saying that's an amazing program. Doulas are so valuable. I used a doula when I was having a baby. So yeah, really glad that they are now newly reimbursable for Medicaid. And when we talk about access, that's another piece. We're thinking about what services are included in my health insurance. And so now folks who have Medicaid can say, I can leverage a doula and I don't have to pay out of pocket. And I can have this sort of really important burst support with me during this really big time in my life. So that's great. When I'm thinking about some other like on the horizon issues that I'm hoping our policymakers are focusing on, two things really come to mind. The first is the need to beef up our mental health or kind of behavioral health care. I think that we continue to see folks who feel that they cannot get an appointment, can't get in the door, can't get a bed when they need inpatient care, things like that. Or, wait lists are just really, really long. And so I think that not just addressing youth mental health, but really across the life course and integrating that more thoughtfully into the way in which we provide physical health care. So you get screenings, you get shots, you get your blood drawn and all the rest. And how can we better integrate mental health care so that folks are able to address anxiety, depression, or the kind of a spectrum of things that they might be grappling with so that they can show up well and thrive in their life. I think related to that, the second piece I was thinking about is our healthcare workforce. And so I think some folks would say that some of the barrier to having robust behavioral health care is that we don't have enough providers to do that. We don't have enough psychiatrists or psychologists, social workers, and the rest. And so thinking about really creative ways to incentivize providers to come to our state. And there's lots of ways that that's happening already, reimbursing for, your medical school loans to say, come be in Michigan, be a doctor in Michigan, be in a rural place where access is even more limited. We will encourage you to come and stay in our rural hospital, and then we'll pay back some of your loans, things like that. And I know that even in the legislature right now, there is a bill proposal to allow interstate medical licenses. So someone who maybe is based in Illinois can still practice in Michigan. So we have access to those providers because I think that Michigan being an aging state, we are going to need doctors, nurses, and all the rest, all the different kinds of providers to be able to provide care and support for our population, again, across the life course, but certainly as we age, we know that we tend to have greater healthcare needs. And so how do we meet people where they're at? How do we make sure that we have the doctors and the workforce that we need to get the care that we deserve?
That's so great to hear. One of the things that we do over at GRI is that myself, along with my team, we work with the educational extension of GRI. So we have the pathways to healthcare careers, and we help individuals from the babies in elementary school all the way up to our adult learners get on that pathway to healthcare careers, even as far as like with the doulas. We want it to kind of be like a launching pad into the healthcare career. So you can start off as a doula. If that's just what you want to be, that's fine. But hopefully you can also enter into that pathway of maybe an LPN. And then from being an LPN, maybe you go for your BSN. And then next thing you know, we have our nurse midwives around here, So it's really good that you bring that up and the importance of what that is.
Absolutely. Absolutely. Yeah. We think about wanting greater diversity in lactation consultants, our nurses, our CNAs, all the rest. And so that's such a great program. I'm glad you all are doing that. We need everyone really thinking about this issue because we want to be sure that we can meet the needs of the folks in our state. We want to encourage folks to come to Michigan, stay in Michigan, age and live here. Yeah. And we want to make sure that we have the workforce to support that.
So how can individuals and organizations advocate for this change?
I love this question. I would say first, it's like leaning into your own curiosities, where you have passion, where you're wondering, where's the money going? What's happening in my community? Who's addressing this? Who cares? So I think kind of doing your own research and leaning into those curiosities is really important. And then having conversations, sharing what you found and those questions that you have with friends, families, colleagues, folks in your community, and seeing who has shared values, shared interests, and then getting tapped into other organizations potentially who are doing work locally on the ground in your community, or starting to reach out, like who is my state representative? Who is my state senator? What are they doing, and how is that different than what my U.S. representative is focused on and what's in their jurisdiction of decision making? And I would say for the league, we do a lot of work. We call them advocacy boot camps, but a lot of work to try and build capacity among individuals and organizations to kind of learn what is public policy, how do I advocate, how do I do this, what is testimony when I show up.
What does that look like? You say advocacy boot camp, like that just stuck out. Like, what is that?
Yeah. So it's really like a one day. We do it virtual. Sometimes we do it in person, and it's really just to kind of learn what is messaging. How do I show up and have a meeting with a lawmaker and have talking points prepared, and how do I share my story in a way that's really going to resonate and keep their attention? How do I prepare for that? How do I speak in a collective voice? How do I connect with partners maybe who care about the same things that I care about, and we can all show up together because, there's power in numbers. So we do a lot of sort of working with folks to feel comfortable talking to the media, talking with lawmakers, and really just to learn how to maybe start to build an agenda for their organization or just for themselves as an advocate for their kid or their parent, whoever it happens to be able to really show up and share their voice and make sure that they are a part of the decision-making process.
Yeah, no, I actually love that and the importance of it. I can only imagine how intimidating it may be to show up and speak to and address these policymakers. So the fact that you all offer that is huge, and I'm sure that it makes all the difference. So finally, what is the call to action? Like, where do we do? Where do we go?
Yeah. Well, I would just say, I'm not unaware of the environment that we're in. I would say what I've been practicing is to just take a deep breath when you open your phone and you see the latest news. There can feel like there is so much, but I would really just get tapped into what affects your day to day. Are you concerned about access to medication? Are you concerned about the cost of bus fare? Are you concerned about who is taking care of your aging parents and how they can get support and stay in their community rather than living in a nursing home? Whatever the issue is, I think just getting into it a bit more and figuring out who else, whether it be an individual, a leader in your community, or an organization that really represents that issue. How can you be tapped into that? How can you lean in and say, I want to get more active in this space? Where can I learn and where can I add value and support? And I think that would be number one. I think I'll also just plug that the League is hosting a public policy forum in about a month, March 13th. It's in Lansing in person, and it's really just a place to come together, to network, to hear from folks. The topic is really focused on economic justice, but we'll be talking about housing and health and how that connects to economic security and thriving in our state. And so I would say that was a really great opportunity just to kind of show up and get to know, what is this whole policy world? How do I get involved? How do I make my voice heard? I think that would be a really great starting point.
All right, Amber, so we want to give you an opportunity for a little shameless plug here. If you want to link anything that you have going on or, socials or anything like that, they'll be able to, go ahead and subscribe down and the link will be somewhere, but go ahead.
Yeah, I would just encourage folks to visit the League's website, mlpp.org, get tapped into our newsletter. You can find information about our upcoming public policy forum, learn some more about our advocacy boot camps if that's a place you want to grow your muscle. Mm-hmm. And, the last sort of call to action, I would just say that you have voice, you have power, and use it. Learn and get tapped in, and we would certainly welcome more folks who are in this space defending Medicaid, defending healthcare access, trying to improve outcomes in our state. So, I just would encourage folks to get connected. You're not alone, and your voice really matters.
Yeah, well, thank you so much, Amber. And we want to thank you guys for joining us today for another conversation. Regardless of how you all are listening, we invite you to go ahead and follow us on all platforms. Go ahead and give us a like, share, and subscribe. And we'll see you guys soon.